Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube. A reminder to maintain audio quality, to please keep your phones on mute until it's time to ask your question. If you're able to do so, please use *6 to mute and unmute your phone. Joining us for today's media briefing are Stephanie Smiley, the State Health Officer and Interim Administrator of the DHS Division of Public Health, and Major General Paul Knapp, Head of the Wisconsin National Guard. We'll begin the briefing with remarks from State Health Officer and DPH Interim Administrator Stephanie Smiley.
Good afternoon, and thank you for joining us today. I'm Stephanie Smiley. I'm Wisconsin's Interim State Health Officer and the Administrator for the Division of Public Health. I want to start today by reminding everyone of the importance of testing. One of our most effective tools in helping stop the spread of COVID-19 is testing, and everyone who needs a test should get a test. If you're experiencing any symptoms or have been exposed to COVID-19, please consider getting tested. As part of our continued collaboration with the Wisconsin National Guard to stand up community testing sites across the state, we're now rolling out COVID Connect, and it's also known as Dynamics Test Registration Application, or DTRA. This is a website that the National Guard will use at their testing sites to make the process easier for everyone, those of you seeking tests and those of us monitoring the test results. I know that Major General Knapp will talk a little bit about this as well, because the site at the Alliant Energy Center in Dane County is already seeing impressive results, but I wanted to take a moment to walk you through what to expect at a testing site using this website. So when you arrive at a National Guard community testing site, you'll be asked to register on COVID Connect using your cell phone. Of course, there's alternatives if you don't have access to a smartphone, but this enables the process to be as contactless as possible. COVID Connect will walk you through the questions that we need answered to help us understand the status of COVID-19 in Wisconsin, and also to help future contact tracers who will follow up with you if you receive a positive result. The questions include information on employment to determine if you're a healthcare worker or first responder. We're also looking at a health status check to determine if you might be immune compromised, and questions about whether your current symptoms, what current symptoms you have, and the date that they started. After these questions, COVID Connect also asks if you have had close contact with anyone who has tested positive for COVID-19 and whether or not you've traveled in the past 2 weeks. Finally, you're asked to enter some personal contact information to better facilitate the contact tracing process in the future. All of this information is linked to your test specimen, which helps reduce human error and provides a more rapid test result. I'd also like to add that some partnerships have been really instrumental in making COVID Connect possible, specifically with the design and training assistance provided by Exact Sciences, Epic, CUNA Mutual, and American Family. Thank you so much for all of your help with putting COVID Connect in process. And again, testing is an incredibly helpful tool for us, and so is contact tracing. That's why it's really important to answer the phone if a contact tracer calls you, and to answer their questions as thoroughly as you can. If a contact tracer calls, please remember that all calls are confidential, and the contact tracer is never going to ask you for your social security number. If that happens, that is fraudulent, and we'd want you to report that call to local law enforcement. A contact tracer will need some of the same information about symptoms and travel as what we're going to be asking in the COVID Connect website. So this is one of the reasons why it's going to prove to be so helpful and time-saving as we continue to expand its use. Contact tracers will also ask questions about your residential and occupational settings to get an idea of potential spread. And then they'll walk you through your activities in the past 2 weeks to determine if you attended any events or gatherings, and to determine who you'd been in contact with while you may have been contagious. They're also going to share information with you about how to effectively self-isolate and ask you questions that would help them provide you with the resources you might need as you isolate. Your answers to these questions help us in our response, and they can also help you as you care for yourself. Please access a test if you're experiencing symptoms. As a reminder, symptoms for COVID-19 include a cough, shortness of breath, fever, chills, a sore throat, runny nose, muscle pain, headache, and the new loss of taste or smell. And while these are the most common symptoms, we also know that some people are experiencing extreme fatigue and abdominal issues. Even if your symptoms are mild, we're urging you to get tested. So now I'll turn it over to Major General Knapp for an update on the Wisconsin National Guard.
Any better now? Okay, how about now? Looks.
Oh,
I see.
Getting a head nod.
I see Stephanie nodding her head. That's a good sign.
All right, I think you're live again.
Okay, did you get any of that, or should I start from scratch?
Start it over.
All right, we'll start from scratch. All right. Okay, here we go. Good afternoon, ladies and gentlemen. I'm Major General Paul Knapp, Wisconsin's Adjutant General. I want to thank you for the opportunity to join this briefing today to provide an update on Wisconsin's National Guard operations as it relates to the response to the COVID-19 pandemic. More than 1,000 citizen soldiers and airmen from the Wisconsin National Guard remain on duty supporting the state's response to coronavirus. This is down from a peak of approximately 1,400 back in May when the Guard was performing a variety of missions in support of this state and its citizens. Today, our efforts are focused largely on the COVID-19 specimen collection sites, staffing a state call center, and providing logistics support to the specimen collection effort. Our troops have contacted more than 182,000 residents statewide, informing them of their test results. We have 20 teams operating testing sites around the state, and earlier this week, we achieved a new milestone as we crossed more than 200,000 tests administered at Wisconsin National Guard supported sites. More than 50,000 of those tests have come at the Alliant Energy Center in Madison alone, and nearly 50,000 tests have been administered at multiple sites across Milwaukee as well. We've seen extraordinarily strong demand for testing at our sites in both Milwaukee and Madison in recent days and weeks. In fact, we've logged a daily statewide high at the Alliant Energy Center on June 30th, where nearly 3,100 people were tested that day. We've seen demand fluctuate at each of these sites from as little as a few hundred tests each day to more than 3,000 in a day. We've recently experienced long waiting lines at these sites as the demand for testing has increased. We appreciate everyone's patience and understanding as we work to administer these tests in the most efficient manner possible. We've flexed additional teams and personnel to these sites to help open additional drive-through lanes and increase throughput when necessary. We're very excited for the new DTRA website and technology being developed, and we're confident that it will help cut down the wait times at the testing sites, in addition to providing emailed testing results. Last but not least, I want to reiterate how proud I am of each of the citizen soldiers and airmen from the Wisconsin National Guard, who have answered the call so selflessly since this historic and unprecedented response began back in March. Never in our history have so many of our troops answered the call in support of a domestic response for such a sustained period of time. Serving our state during emergencies is one of our core missions. It's who we are, but I think it's safe to say that they've gone above and beyond the call of duty during this historic mobilization. Simultaneously, hundreds of our troops remain deployed to locations around the globe in places like Afghanistan, the Middle East, Ukraine, and the Horn of Africa. It's truly been an honor to serve with you throughout this response. Thank you for your time this afternoon, and I look forward to taking any questions.
And thank you. And we will now open it up to questions. A reminder to maintain audio quality, to keep phones on mute until it's time to ask your question. And today we will allow for one question and a follow-up. And we'll begin this afternoon with David Wahlberg from the Wisconsin State Journal. David? And a reminder to use *6 to unmute your phone. David Wahlberg, Wisconsin State Journal. Okay, we're going to move on then to Martin Rakakoli from WORT Radio in Madison. Martin? Martin from WORT. Okay, moving on then to Todd Richmond from the Associated Press. Todd?
This is David Wahlberg. Did you call on me?
I did, David. You were the first one. Go ahead, please.
David Wahlberg, did you call on me?
Yes, I did, David. Go ahead.
We're not hearing the calls being made on the phone line.
And we have... Sorry, we appear to be having more technical difficulties. We'll try again with David Wahlberg from the Wisconsin State Journal. David?
Hello, can you hear me?
Yes, we can. Thank you.
Okay. So I believe Wisconsin Connect started at the Alliant Energy Center site already. When was it rolled out there? When is it being rolled out statewide? How do you assure privacy of the information, and what impact do you think it will have on wait time?
Sure. Sorry, it took me a minute to find my mute button. Yeah, so I can take a stab at that. So this has been rolled out several days ago. I don't have the exact date of when it began piloting, but we did have this rolled out at the Alliant Energy Center for the past several days for certain, and we are hoping to roll this out to other wing sites in the next week or so. But again, a lot of this is taking some coordination with our local partners to ensure that that we're able to roll that out within their area. The other piece that I'll mention is that this is a secure website, and all of the information that is provided is confidential. It goes directly into our disease surveillance system, and so it's the same connections that we're using in order, once we get those test specimen results, all of that goes right into our Wisconsin disease surveillance system.
Thank you, David. Now we'll go to
the impact on wait time.
I'm sorry, David, was that you?
I just asked again about the impact on wait times from this.
Gotcha. This is General Knapp. Can you hear me?
Yep.
Okay, I see Stephanie giving me a thumbs up, so I'll just press. So on wait times, it'll definitely affect wait times in terms of making them much better. I just checked before this call, and at the Alliant right now, wait times are well under an hour. So I know there were a lot of complaints last week about wait times above 4 hours. And so to have wait times under an hour at the Alliant Energy Center is great. And it's a combination of the additional lanes that we added, as well as the DTRA rollout.
Okay. Thank you, David. Now to Martin Rakakoli from WORT Radio. Martin? Martin, are you there? And a reminder, *6 to unmute your phone. Once again, Martin Rakakoli. Okay, move on then to Todd Richmond from the Associated Press. Todd? Again, Todd Richmond from the Associated Press. Okay, we'll move on then to Stephanie Hoff from West Politics. Stephanie.
Hi, thank you for taking my call. How much did COVID Connect cost?
That is a great question. I don't have that information in front of me, but it is something that we can get back out to you after the briefing or during the briefing.
Thank you, Stephanie. Now to Ryan Curry from NBC 26. Ryan?
Hi, good afternoon. Hopefully you all can hear me okay.
We can, thank you.
My question is testing sites around the states. I know a lot of places, especially here where we are in Northeast Wisconsin, some places require you to have at least one symptom in order to get tested. Is there any sort of plan to maybe expand it back to testing sites for anyone, even those who are asymptomatic or just want to get tested in general?
Yeah, I'll take a stab at this one. I think that it's a great question. I know that there are a lot of folks who are really interested in getting tested if they don't have symptoms. Just wanting to know, for peace of mind, and what we're encouraging is that people, if they have been exposed, that is something that we want to make sure that people understand that they should be able to obtain a test, understanding that there are still limitations in our testing supply and in our capacity to, test. But we're suggesting that everybody who wants to get a test should get a test, and especially those, who may be asymptomatic but do have direct exposures, to individuals who have tested positive.
And do you have a follow-up, Brian?
No, I'm okay. Thank you.
Thank you.
I'm okay. Thank you.
Now we'll move on to Michelle Melby from WLUK TV. Michelle? Michelle Melby from WLUK. Okay, moving on to Asal Razazi from Spectrum News. I hope you got your name right, Asal.
Hi, can you hear me okay?
And who is this?
Yeah, so my question is just, do we know how many additional troops have been deployed to help with opening additional testing lanes?
Yes, in terms of additional soldiers or airmen to open additional testing lanes, assuming you mean at the Alliant Energy Center, we've right now opened up the maximum number that we can within the footprint that we have allocated at Alliant, which is 6 drive-through lanes and 1 walk-up lane.
Thank you. Now to Adriana Mendez from TMJ4 in Milwaukee. Adriana? Adriana Mendez from TMJ4. Okay, we'll move on to Caroline Peterson from NBC 15 in Madison. Caroline?
Hi, can you guys hear me okay?
Yes, we can. Thank you.
Thank you. Thanks for taking our call. Question, I know Dane County issued the mask mandate, and they've expressed that they do not, the goal is not to issue any citations, and it's kind of a self-policing effort. I was curious to get DHS's thoughts on how they believe the public should handle that, in terms of, monitoring who and who isn't wearing a mask and things like that.
Sure. So I think that what is important to do, and again, situations in Dane County will be handled, by that local public health department. But in terms of, the state perspective on that is that we know that having, a barrier, any kind of barrier, whether that's a cloth face covering, if that's a clear visor, those kinds of things, that is what is going to help keep, sort of those secretions from, going out into the atmosphere. And that is how this, this disease is spread is through those secretions and through touching your face. So what we would say is that it is one of the tools, one of the only tools that we actually have in our toolbox to slow the spread of this disease. And in terms of the policing part of it, I think that what we would say is that we just want individuals to do the right thing and try to protect themselves and others by wearing that cloth face covering or other barriers and staying home. I can't really speak to how the recommendations that Dane County has put forth specifically, but certainly stand by the recommendation to encourage people to wear that face covering.
And Caroline, do you have a follow-up?
Nope. Thank you.
Thank you. Now to Maddie Heim from the Appleton Post-Crescent. Maddie?
Hi, this question is for Major General Knapp. Are there any plans to ask National Guard members to help the Department of Workforce Development process unemployment claims?
Hi, Maddie. As of yet, we have not been asked to help process claims. Like any other requests from other state agencies, we'd have no compunction about accepting those and helping to our best ability.
And a follow-up, Maddie?
Nope, I'm good. Thank you.
Thank you. Now to Rob Menser from Wisconsin Public Radio. Rob?
Yes, thanks. So this is a question for Stephanie Smiley. So on the federal level, there's a lot of discussion right now about reopening schools in the fall, and mostly schools are not open in Wisconsin right now, but a lot of camps, summer camps are open, and daycare settings are open. And I guess I just wondered what we know from contact tracing about transmission in those settings. Are they favorable to transmission or not?
Yeah, so it's a really good question, and I think it's something that we don't necessarily know the answer to related to schools, and so that is sort of one of the sort of outstanding things that we're looking at based on information coming out of other countries, looking at information coming out of other types of settings that that may help us as a proxy, but we're not going to necessarily have the most information that we would like in order to know exactly how that's going to how that would unfold, or how that how transmission necessarily occurs within a school setting. What I will say is that, in terms of, we know that outdoor activities tend to have less of a risk, or you can still be exposed. You can still certainly acquire COVID-19 through outdoor activities, which is why we still recommend physically distancing. But it really is going to be those same principles that are going to require people to engage in activities more safely, which is physical distancing and wearing a cloth face covering and staying home when you're sick, not touching your eyes, covering your coughs and sneezes. All of those things, are going to be the ways that we keep individuals safe. As far as the contact tracing and what we're seeing in terms of investigations, I will say that a lot of the investigations that we're seeing across the state are related to people gathering together and not taking those precautions with physical distance and or face covering. And so that doesn't mean that that's a fail-proof way, but it is certainly going to cut down on the amount of transmission and spread that we're going to see. So it's probably less about the setting and more about what people are doing to enable, to protect themselves and others.
And Rob, do you have a follow-up? Okay.
That'll do. Thank you.
All right. Thank you. And now to Natalie Sopila from WAOW TV in Wausau. Natalie.
Hi, can you all hear me?
Yes, we can.
Okay, great. This is sort of a follow-up question to the mask question from previously, but so actually just today, Marathon County announced it's requiring employees to wear masks, and I know the state is requiring that of its employees as well, and obviously Dane County with its mask ordinance, but I was just wondering if, do you think enough is being done on the masking front, and if there's, anything, if you would be in support of tighter masking restrictions or requirements, I guess I should say.
Well, I think what I would say is that, we want people to do the responsible thing, right? We want people to choose to wear a mask. We want people to, make the right call in order to keep themselves and others that they come in, may come in contact with safe. In void of that, we know that certain parts, of places in the country as well as within our own state are feeling compelled that, not enough people are making that choice. And so, they really need to sort of nudge folks to be able to mask up and make sure that folks are protecting themselves and others. So I would say when it is needed, yes, we would support, a nudge to have people ensure that they're protecting themselves and others.
And Natalie, do you have a follow-up?
Nope, I'm good, thank you.
Okay. Because we had some technical difficulties early on, I'm going to go back to the list of those that we called on who weren't available the first time. And we'll begin with Martin from WORT Radio in Madison. Martin? And a reminder to use *6 to unmute your phones. WORT. Okay, moving on then to Todd Richmond from the Associated Press. Todd.
Can you hear me? Hello?
Yes.
Oh, hello.
Hi, Todd.
Anyone there? Hi. I use my cell phone. I don't mute my cell phone, so I have to call in on a line. I'm a little confused about how the registration works through the website. If I register to take it at like 3 o'clock, right, at Energy Center, and I find cars in front of me who just and as sort of walk up, so to speak. How does that help speed things?
Do you want to take that, Major General, or should I?
Sure, I'll start.
Okay.
You need a break. You've been answering a lot of questions. So, hey, Todd, that's a good question. And the big way that it speeds things up is that interview process that we have to do if you aren't able to register online using COVID Connect. So when you come up without COVID Connect, you're one of the first people that you encounter are the soldiers are airmen, and they're going to do an interview. And they're basically going to take down all your information from you. And then you're also going to fill out a waiver and get all of your contact information. That can take around 5 minutes or so to do. And it's also really critical that that information is double and triple checked to make sure that everything that goes into the system is accurate. So if you're able to use COVID Connect, while you're waiting in line, you can do all that process in advance. And if you've completed in advance, when you get up to that point in the line where you're met with an airman or a soldier to take your information, the website and the process of registering will give you a QR code. And when they can just scan that QR code, and it will populate their system. They'll confirm all the information is there and accurate and that you're ready to test. And that's it. So it can take, it's really quick. It could take as short as 30 seconds. So you're really cutting the time down drastically that it requires us to process each car in line. Does that answer your question?
Todd, are you still with us? Okay, hearing nothing, we'll move on then to Spectrum News. Spectrum News? And a reminder, *6 to unmute your phone. Once more for Spectrum News. Hey, WKOW-TV, Danny Maxwell. Danny?
Hi, this is Francisco instead of Danny. I am just wondering if with this new program, will it scale up for if the demand for more tests increases, because we saw that kind of bottlenecked approach in the past couple weeks. Will this help if thousands more people want to get tested?
Yeah, definitely. So this is that is pretty much why we're trying to roll this out to other testing sites as well. Is that we want to be able to meet the demand that we're seeing, and because we're seeing increasing case activity in our state, we want to make sure that we have the most efficient way, to one, not only get people through the process, of this, but we also want to make sure that the information that we're receiving, that we get enough information. Often what we've found, through our quality improvement, checks is that sometimes we're missing some information, and we really need to have that in order to get in contact with people once they get tested. We need to be able to follow up with them and provide a test result. And so what this does is the fields are required, and so we want to make sure that we're able to follow up. And then if for some reason someone does not have either an email address or a phone number, there's an additional way that we're working through with local public health departments to figure out, the best way to get in touch with those people as well. So we really do think that it is scalable. It is something that can handle thousands of folks, and so we're looking forward to getting that efficiently set up.
Any follow-ups, WKOW?
The only follow-up is, you said that, you know what, never mind, no follow-up.
Okay, thank you. And finally, Adriana Mendez from TMJ4. Adriana? WTMJ Milwaukee? And a reminder, *6 to unmute your phone. Adriana from TMJ4. Okay, well, with that, we will conclude today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a good afternoon.